Hello, my name is Dr. Unique. I'm a Nigerian trained medical doctor currently practicing in the UK. You're welcome back to this channel. Today, I'll be answering a whole lot of questions that I've received concerning what are the tips, the requirements, and the things that can give you advantage to secure a healthcare assistant job in the UK. Like I said earlier, healthcare assistant job has been declared as part of the UK shortage list, meaning that people can apply, okay, for healthcare assistant job and secure it and use it as one of the easiest way to come into the UK legally while working out any other thing they want to work out. Okay. Now, who is a carer? I want you to know that what really inspired this is because UK do not believe in a kind of people who are the working age losing their working time just to care for their age or sick relatives. So what does that mean is that people can be in the hospital, like I have a whole lot of patients admitted in the hospital, but they don't have their relative sitting beside them. Their relative have gone to work, they are working, so their carers are paid to take care of them in the hospital. Some are aged parents who can no longer work at home. Their relative they do not need to encroach into their relatives' personal time. Their relative will still be working while another person do the work of taking care of them. So this is how the developed country works. So a carer is someone that helps elderly, sick people with the activities of what daily living. That's who a carer is. So basically, most people and most employer would like people that have experience with what a carer is before employing you. And that's why I'm here to tell you what are the things that can help you. Now, one of the things that will help you is if you have IELTS, like I've said before, because if you can prove that you can speak English, you score a point. Because most time before you employ in the UK use what we call point scoring. So if you have an IELTS, you have an edge over someone that do not have what IELTS. So even if that UK have declared that you do not need any requirement to get this job, it is important that you know there are things that can give you an edge because due to the fact that you mustn't be a qualified doctor or nurses to apply for this job, so many people are applying and you really need to be on top of your game. So one of the things that can help you is to get an IELTS. Second thing that can help you while applying for the job is this: you can do some kind of training. Now there are courses that are very very important that can give you an edge. One of them is safeguarding course. There are 15 courses you could do. I can help you with the link of the 15 courses you could do. There are blue stream courses. There are so many courses online that you could do. If you go online and type 15 courses I can do to enable me apply for healthcare assistant job, 1,001 million courses are there online to help you out. So you could do about safeguarding basic BLS so that when you are in a care home, you went to visit the elderly slum, you would be able to assist that person. So that's just about that. So some courses are going to help you. Now, aside these courses, when you are planning your CV, another thing that can help you is your CV, making a standard CV. When you are making your CV, it is good that you include all things that have involved you caring for people, which involve caring for your baby if you're a lady, even if you're a guy, caring for your own baby, caring for your younger siblings, caring for your aged parents, your grandfather, your grandmother. You could put all those things. Anything that is going to show that you've cared for people, you've been part of people, and you have experience with caring for people who are disabled, you could do that. Now, if you don't have any medical nursing experience and you know that this is nursing related, health related, one of the things you could do is to volunteer in the hospitals. Go to hospital or care home or disabled home. There's like for those of you that I live in Abakaliki, there's a home that's called Destitute Home and the home of disabled. You could volunteer at your own time to go there for one hour a day and you kind of have experience of what is happening there, what it means to care for people who are aged. If you finish all these things, because during your application of your job, one of the things that UK usually need is your reference. This book can help you to give you a reference. And if you can also volunteer in the hospital to help care for sick people. So volunteering is going to be one of the things that can help you. Now, another thing that can help you is if you know that you want to get UK job. I want you to know that even for doctors, I've seen so many doctors that pass their exam, nurses that pass exam, and it takes them a while to keep applying. They keep getting, unfortunately. So securing a job in the UK is a big deal. So if you want to get a job in the UK, you must be willing to make massive application. So you have to make massive application. Where are the sites? I gave a site before, www.trackjobs.com. You could get some hospital jobs there, or healthcare jobs there. And also there is a job that is called carehome.uk.com. Go to carehome.uk.com. These are the two sites that can help you. If you go there, you apply for care home directly to care home directly. Those ones are more private. But if you go through the track job, you get more of NHS jobs and hospital carer jobs. So if you get this job, you should be able to ask them. You should be able to first of all package your CV in the way that your CV can invite you for interview. Once your CV invite you for interview, you should also now practice those courses that you have done because most of the questions that we ask about what do you know about safeguarding, what do you know about basic life support, what do you know about this, that will come from those courses, you revise those courses properly, and when you get an interview, you should be able to defend the CV that you presented. So I think this is the basic thing you need. Now, so many people have asked me a question, Dr. Unique, do you think that the money worth it? I want you to know that everybody that living in this UK earn minimum wage. There's nobody that live in the UK that do not earn minimum wage. The government have calculated how much do you require to pay house rent, how much do you require to do this, how much do you require to pay to do that before they set up what is called minimum wage. So if you must be employed into the country, you be employed using a minimum wage, and if you earn a minimum wage, you will be able to pay your rent in a shared apartment, do your basic thing. Feeding is very cheap here, and still have some money to save for yourself. So do not be afraid. Oh, will I be able to do this? Will I be able to do that? So do not mind my bleed. This is just my bleed. Mine was down. I had to pick up the nursing bleep. So the bleep here is bleeping them to attend to patients in different rooms. So, but I'm with it because I'm charging my own. So, but I know when mine is a cardiac arrest. Whenever it bleeps, I know about it. So do not bother about it. All right. So what I'm trying to maybe encourage is that one thing you have to know that every journey, everything about the journey of abroad has to do with a whole lot of hard work. You have to work hard. Even when you come over here, you have to work hard. I want you to know that before you come abroad, you are indeed needed. And it starts from hard working from home. Do not give up. If you want to come into the UK, even if you're a doctor, a nurse, or whatever, you want to come into the UK with healthcare assistant, but before you now transfer and do your own thing and do your own exam to practice in your own area, it is doable. I want you to know that it's doable and you can do it. I have talked about masters before in my previous videos. So many people have told me that it's expensive and they prefer to come in and start working. Everything is possible. I just want to encourage you. Do not be discouraged. Keep pushing this journey. And I want you to know that one day it's gonna make sense. So I don't know if this video has been useful, if you've gotten any useful information. This information may not really be for you. You may have a sister in the village, you may have a brother, you may have someone elsewhere that will need this video. Share this video with them and help them. That may be introducing them to a fortune. Thank you very much for stopping by. If you're my return subscriber, I'm just here to give you a very big hug. Thank you. You guys are the one that keep encouraging me, asking me questions to make videos. Whereas if you're coming in to see me for the first time, remember to subscribe to my channel. I'm Dr. Unique. I am a Nigerian trained medical doctor. I'm currently practicing in the UK. I make videos on lifestyle, medicine, relocation, and all that, even marriages. At this space, we are doing our relocation series because I relocated, into the UK, and I have a whole lot of information I'm sharing. We'll still go to every other aspect of our channel. I'm glad to have you. Thank you very much for stopping by. Bye bye.